Welcome back to my YouTube channel. If you are new to my channel, welcome to Medcode Insight. Hi, I am Nishaba, a certified medical coder. After a successful review of all guidelines, we will now begin our journey to practice questions. We will explore the topic, examine the coding guidelines, and highlight important points so you can easily select your answer within a minute. Let's start our journey with the first topic, incision and drainage of the integumentary system. First, we will discuss the different types of code related to incision and drainage topic. There are four types of codes. The first is for the acne surgery, the second is for incision and drainage, third is for incision and removal, and the fourth is for puncture aspiration. Let's examine each one individually. In the acne surgery, the provider may extract the contents of an acne lesion with the suction type instrument or perform marsupialization on larger lesion or cyst. Incision and drainage procedures can be categorized into two types: simple or single, and complicated or multiple. In a simple procedure, the wound is irrigated with normal saline and covered with a bandage, or the procedure is completed without any complications. In contrast, a complicated incision and drainage procedure may involve multiple incision, drain placement, probing to break up loculations, extensive packing, and a more complex wound closure. The incision and removal code is for foreign body removal. This code is used when a provider removes a foreign object such as thorn, piece of wood, sliver of glass, or fish hook from the lower layer of the skin. In puncture aspiration, the provider inserts a needle into a fluid deposit area on the skin and aspirate fluid or pus to obtain a culture. Code 10040 is for the acne surgery. Code 10060 is for incision and drainage of abscess, and it is for the simple and single procedure. And code 10061 is for complicated or multiple procedure. Code 10080 is for the incision and drainage of pilonidal cyst, and it involves the simple procedure. And code 10081 is for complicated procedure. The code 10120 is for incision and removal of foreign body, and this is a simple procedure. Code 10121 is for the complicated procedure. Code 10140 is for incision and drainage of hematoma, seroma, or fluid collection. Code 10160 is for puncture aspiration of abscess, hematoma, bulla, or cyst. Code 10180 is for incision and drainage. It is a complex procedure. It is for post-operative wound infection. Now let's focus on an important step: choosing the correct code within a minute. When selecting a code from incision and drainage topic, the first step is to determine the type of procedure performed, whether it is for acne surgery, incision and drainage, or for incision and removal, or the procedure is for puncture aspiration. If the procedure is for incision and drainage, check if it involves an abscess, pilonidal cyst, hematoma, seroma, fluid collection, or the procedure is performed on post-operative wound infection. For cases involving an abscess, pilonidal cyst, or foreign body, further differentiate by determining whether the procedure is simple or complicated. Let's start our practice question session on incision and drainage coding to reinforce your understanding of the concept we have covered. By working through these questions, you will enhance your coding skill and gain confidence in selecting the correct codes for various procedures. Let's dive in and see how well you can apply what you have learned. Our first question is a patient present with a cyst on the arm. Upon examination, the physician decides to incise and drain the cyst. The site is prepped and the physician cuts into the cyst. Purulent fluid is extracted from the cyst and a sample of the fluid is sent to the laboratory for evaluation. The wound is irrigated with normal saline and covered with a bandage. The patient is instructed to return in a week to 10 days for follow up. Select the CPT code for the procedure. Our given options are option A with the code 10060, option B with the code 11400, option C with the code 11106, and option D with the code 10061. Our first step is to determine the type of the procedure performed. In the given scenario, the physician make incision into the cyst and extract fluid. This indicates that the procedure an incision and drainage procedure, specifically involving a cyst on the arm. Based on the procedure performed, first we will eliminate the option B with the code 11400, which is for the excision of benign lesion, and option C, which is code 11106 for a biopsy. After eliminating option B and C on the basis of procedure performed, the remaining codes in given option A and D pertains to the incision and drainage of a cyst. One for the simple or single procedure and the other for a complicated or multiple procedure. Since only one cyst was drained, code 10060 is the correct choice. After eliminating option D, our correct option is option A with the service code 10060. It involves incision and drainage of a single cyst situated just below the skin surface. Our next question is patient has returned to the operating room for aspiration of a seroma that developed from a genitourinary surgical procedure performed 2 days ago. A 16 gauge needle is used to aspirate 600 cc of non cloudy serosanguinous fluid. What codes are reported? Option A 10160 along with modifier 78 and N99.842. Option B 10180 along with modifier 58 and N99.820. Option C 10140 along with modifier 78 and S20.20XS. Option D 10140 along with modifier 58 and N99.89. Our first step is to determine the type of the procedure performed. In this scenario, a seroma was aspirated using a needle, indicating that the provider performed a puncture aspiration. Based on the procedure performed, we can eliminate option B, C, and D because all three options involve incision and drainage procedures. After eliminating option B, C, and D on the basis of procedure performed, our correct code is option A with the code 10160, which is for the puncture aspiration of seroma. Modifier 78 is used because the patient is returning to the operating suite with the complication in the global period. The diagnosis is reported as a post-operative complication and the code selection in the ICD-10-CM is based on the initial procedure performed. This is stated to be a genitourinary system procedure. In ICD-10-CM, for the post-procedure seroma of genitourinary system organ or structure following procedure on genitourinary system, referring you to the code N99.842. Our next question is, the patient is seen in follow-up for excision of the basal cell carcinoma on his nose. The wound has healed well and the margins were clear. He has a mass on his forehead. He says it is from a fragment of sheet metal from an injury to his forehead. He has an X-ray showing a foreign body and we have offered to remove it. After obtaining consent, we proceeded. The area was infiltrated with local anesthetic. I had drawn for him how I would incise over the foreign body. He observed this in the mirror so he could understand the surgery and agree on the location. I incised a thin ellipse over a mass to give a better access to it. The mass was removed. There was a capsule around this containing what appeared to be a black colored piece on the stained metal. I felt it could potentially cause a permanent black mark on his forehead. I offered to excise the metal. He wanted me to. And so I went ahead and removed the capsule with the stain and removed all the black stain. I considered this to be a complicated procedure. Hemostasis was achieved with light pressure. The wound was closed in layers using 4.0 monocryl and 6.0 proline. Option A 10121 L92.3 Z18.10 Z85.828. Option B 11010 S01.84XA Z18.10 Z85.828. Option C 10121 M79.5 Z85.828. Option D 11010 M79.5 Z85.828. Our first step is to determine the type of the procedure performed. In this scenario, an incision was made over the mass and the mass was removed. The procedure also involved removing the capsule along with the stain and eliminating all the black residue, indicating that the provider performed an incision and removal of a foreign body. Based on the procedure performed, we can eliminate the option B and D, which correspond to the code 11010, which is for the debridement procedure. After eliminating option B and D, the remaining codes in the option A and C pertain to the incision and removal of a foreign body. Code 10121 is designated for a complicated procedure, as the surgeon indicated in the notes that this incision and removal of the foreign body was considered complicated, leading us to select the code 10121. For ICD-10-CM code, M79.5 is used for residual foreign body in the soft tissue, while L92.3 pertains to foreign body granuloma of the skin and subcutaneous tissue. Since there is no mention of the granuloma of the skin, so the code L92.3 is incorrect. The patient has a history of basal cell carcinoma, which is a malignant neoplasm of the nose, which correspond to the code Z85.828 for personal history of other malignant neoplasm of the skin. So our correct option is option C with the service code 10121, M79.5 and Z85.828. Our next question is a patient present for an incision and drainage of a pilonidal cyst. What is the correct code for these services? Option A 10060, option B 10061, option C 10080, and option D 11010. Our first step is to determine the type of the procedure performed. In this scenario, incision and drainage of pilonidal cyst was done. Based on the procedure performed, we can eliminate option A and B, both having codes for the incision and drainage of abscess. We can also eliminate the option D, having code 11010, which is used for the debridement procedures. After eliminating option A, B, and D on the basis of procedure performed, our correct option is option C with the service code 10080, which is for the incision and drainage of pilonidal cyst. As the procedure was performed without any complications, so it is a simple procedure. In the next video, we will cover the debridement practice question, an important topic within the integumentary system. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.